Of exosomos in brain glioblastoma treatment. Our speaker is from Poland. Pozislav Panik, is correct? Yeah, Pozislav Panik. Please, welcome. 20 minutes.
Okay, my lecture focuses on the potential of exosomes in malignant brain glioblastoma. Let's start with a brief introduction. What really is glioblastoma? Okay, glioblastoma is the most common, most frequently diagnosed and unfortunately most fatal brain tumor with very aggressive course and very poor prognosis. The average median survival for patients with diagnosed glioblastoma is several months. The average rate is about 14-15 months from the time of diagnosis. It characterizes with increased mitotic activity, infiltrative growth, cellular atypia, and very high resistance level for the treatment. So those cells are very resistant to the treatment. The microvascular angiogenesis is also very frequent. The standard approach to the treatment of glioblastoma includes surgical intervention, chemotherapy, and radiotherapy. But unfortunately, there are currently no treatment options that guarantee full recovery from glioblastoma. There are some hopes connected with TTF, so tumor treating fields, and immunotherapy strategies are also emerging, but in the case of so aggressive brain tumor, the new approaches are urgently required. And the new strategies may come with the help of exosomes. But what are really exosomes? The exosomes are small cell-derived single membrane extracellular vesicles. These vesicles can carry many particles called as cargo. They participate in cellular communication, and at first they were discovered in the 1960s. They can carry various cargo molecules like glycoconjugates, like proteins, like many growth factors, lipids, and glycoconjugates. Once again, and here you have a comparison between normal human cells and apoptotic body, some viruses and bacteria that that infect human organism, and then you have the exosome on the very left side. This is the actual size of the exosome comparing to the normal human cell and apoptotic body. Okay, let us. So the next are the functions of exosomes. What are the functions of exosomes? So exosomes may also participate in genetic information transfer. So as I said before, they can carry many particles that affect many signaling pathways around the cells, in the cells and outside the cells, of course. As I said, they mediate in many signaling pathways. They also have immunomodulatory effect. They can also participate in autophagy process, and they also transport, as I said, many cargo particles. So now let's say why are these exosomes so crucial in the development of malignant brain glioblastoma? At first, those exosomes participate in communication within tumor microenvironment. So the tumor microenvironment is very crucial for glioblastoma development and the communication between cells. Those cells communicate with each other within TMA, and those exosomes also help in this communication. What's important, tumor cells, general tumor cells, it doesn't matter if it's glioblastoma cells or lung cancer cells or any other cancer cells. Cancer cells in general secrete more exosomes than the normal cells. This TMA is also responsible for glioblastoma heterogeneity. Okay, as I said before, the specific TMA is not only crucial for the development, but also for the progression of glioblastoma, what really helps them grow and infiltrate all the brain tissue. The content that is this biological content that is transported through the exosomes triggers dynamic changes in this environment by endocrine, paracrine, and autocrine rows. So there are a lot of possibilities to change this microenvironment, and exosomes participate in practically in everything. And secondly, exosomes can carry many types of miRNA particles. miRNA particles are another important molecules that are involved in many signaling pathways, and their concentrations in patient serum may be different. Some miRNA molecules may be elevated, some may be decreased, some levels may be decreased, and what's the most interesting fact is that they can be used as specific biomarkers for glioblastoma and many other cancers in early diagnosis, but I will tell something about it a little later. And now on this poster we can see the involvement of exosomes in glioblastoma. Here you can see they are and they are involved in the elevation of metalloproteinases, in angiogenesis, and with with the immune suppression. Okay, wait a minute. Oh, okay. And moreover, what is also very important, they generate, those exosomes generate a horizontal transfer of EGFR, which is crucial for the aggressive, which is responsible for the aggressive course of glioblastoma, and the recipient cells that gain this EGFR from the parent cells became more aggressive, and that's why the treatment of, that's one of the reasons why the treatment of glioblastoma is very hard, and the course became more and more aggressive. Okay, so now let's have a look why and how exosomes can help in the effective treatment of glioblastoma. So the main challenge of glioblastoma treatment is that most drugs, like temozolomide, called TMZ in abbreviation, cannot pass through the BBB barrier, so the blood-brain barrier, which is crucial here. But nowadays, nanotechnology offers a new approach for drug distribution, like liposomes, like exosomes, like many synthetic nanoplatforms. And as we already know that exosomes generate more exosomes than normal cells, we can use them to carry specific anti-cancer drug and then defeat the cancer with its own weapon.